And there are some practices that are doing a great job with that. And those technicians have autonomy, and they're doing a basic physical exam and saying, yeah, this puppy's eating and drinking and feeling good. We can go ahead and booster this vaccine. And they're educating the clients on what needs to happen next. And if we can take that and run with it and implement that in more practices, that's, I think, where we start with this. And we're not going anywhere close to outside the Practice Act. We're just utilizing these technicians for what they can do.
Sorry for saying sorry. Media presents the Purr Podcast, the best podcast for feline medicine and surgery with tips, tricks, and updates for the entire veterinary healthcare team. If you're dying to know more about cats, keep on listening. Here are your hosts, Dr. Susan Little, famous cat vet and textbook author, and Dr. Jolle Kirpenstein, talented surgeon and social media geek.
Hi, this is Dr. Susan Little.
And this is Dr. Jolle Kirpenstein.
And together we're the Purr Podcast.
Yes, we are the Purr Podcast. You're listening to the right podcast, the best podcast in feline medicine and surgery.
Yeah, and we're very excited today because we have the second time only, hopefully there will be more in the future, but a veterinary technician joining us today. Doctor, I almost called you doctor. Look at that.
I know.
I don't need a promotion.
No, my gosh.
Maybe she has a PhD.
You never know.
Someday.
Why not?
We are so pleased to have Megan Brashear with us.
Yes.
Thank you, Megan.
Thank you. I am super excited to be here.
Even if we can't call you doctor.
Yeah, not yet.
Exactly. But she's a double award winner.
She is.
So
yes.
that works too for
We're
me.
in the presence of greatness.
I know. It's going to be very exciting. There was a question from the audience a little bit about the judging part. That when you have a case where you're now balancing about the welfare of the animal and the choice of the owner. And I can give you an example. I had, really early in my career, I had a case where this dog was shot and he had a complete, avulsion of his spinal cord, couldn't walk, and we treated this dog for months and months and months and months and months. The owner refused to pick it up, and after 6 months later, he picked it up and took it home. But those cases also frustrate you on the other side of the picture. So how do you deal with that?
Those are really difficult. Those I think are the most challenging cases, and I continue to tell myself that these owners are having such a difficult time with this decision. They literally cannot make it. And it's not, we always go to, why are they torturing this pet? But that's not
not what's in their
exactly.
Head.
That's
right.
not, they're not sitting at home, enjoying the fact that their pet is struggling. They literally cannot make that decision. And I've gone through this myself now. I had a dog who had mobility issues, and he probably had a spinal tumor, and he had a lot of pain, and I did handfuls of medications. I did acupuncture. I did, rehab, and just trying to get him comfortable, but struggling with that decision. Is today the day? He had a really bad day yesterday, but he might have a good day tomorrow. And he had a lot of muscle wasting, and he fell, he's so independent, and he tried to go down the steps, and he gave himself a laceration, and do I put him through the repair and blah? But in no moment did I ever think, this is so fun watching him suffer. And when we judge clients for not being able to make a euthanasia decision, what we're doing is saying these clients are enjoying putting their pet through this. And so it's really hard to have that perspective, but we just need to talk about it. I think as staff, we kind of, think we're the only ones, and we just get bitter, and then we turn that into anger against the patient. I can't believe you had diarrhea again. And we just, somehow you need to find it somewhere inside of you to have compassion for this owner that cannot make this decision. And my job is to make the patient as comfortable as I possibly can. And that's what I focus on. What
do you think about quality of life scales? I've been more interested in them and helping people make decisions. Right? It might be a little more objective way for them to look at a score or
I am a fan of those.
Yeah.
I don't think pets tell us when it's time. I think,
or at least they don't all.
Exactly. And that's a hard thing, but I don't like to put that blanket statement out there that your pet will tell you. You'll know, because
it's a lot of burden on the poor pet for one thing.
Exactly. But if I could look at a number from day to day or take pictures once a week, because you'll start to see when you're looking at that animal every day, you don't notice, holy cow, look at their muscle wasting. Holy cow, look at, their eyes are not bright anymore. And so if you can, and have as many of those objective kind of parameters as possible, that's only helpful, I think.
I think we're getting now better in evaluating that in cats. It used to be that they were all defocused, so we had not as much information behind cats. I think more information is coming out, so that makes it easier. I also think that a lot of owners cannot see this.
I totally agree.
Because, if I take my D out, I see it walk and run and play and that sort of things. I don't take my cat out and see those things. So the cat is in the closet.
Yeah.
Yeah, but he's always in the closet, so that's normal.
Yeah.
And that he didn't come out for 4 weeks. Okay,
why does your cat live in the closet? I'm having a problem with that.
She loves the little closet, She has a little thing that she can sit up, run around.
Yola's allergic to cats. He doesn't have a cat.
Cats, whatever, So
this is a fictitious cat we're talking about.
Got it. I love that you have
he has a make-believe cat.
I know.
I have 2 cats, by the way.
Cats,
so no, not.
Oh, you
not
have
that
2
you
cats?
I do.
Oh, Yola's perked right up.
Yeah, tell us about those cats.
So I have a brown and white tabby who is 12 years old, I think. He was abandoned as a kitten in someone's barn, and I think his mom was probably moving kittens and she didn't get to him in time, and so someone thought he was abandoned. But he was about 4 weeks old, and he came into the hospital where I was working as this abandoned little kitten, and I said, I will take him, but only if he eats on his own. I am not bottle feeding. And so we put food in front of him, and he just dove into it. Done. So he's a polydactyl little Spitfire, and he was my only cat for a few years, and my dogs raised him, and so he used to wait at the door and go outside and go potty. He did not. I had a litter box for him, and he never used it, and it was amazing. And he thought he was a dog, and so he's a very social, like overly social, almost annoying cat.
I can't believe Mom said that.
Yeah, no, he's...
Well, cats that are not raised around other cats are different.
He is.
Hopefully in a good way.
Yes. Because then my second cat, his name is Newman.
From the apple?
From
Paul.
From Seinfeld.
Oh,
Newman.
That Newman. Okay. Does your cat know he's named after that Newman?
He behaves as such. He is a beautiful medium hair, classic brown tabby, like with the spiral, and he has this like rabbit soft fur. He has the longer hair, but there's no undercoat to it. And he was feral. And his mom had been hit by a car, and these 3 kittens came in, and they were hissing in the back of the kennel. And
now,
the humane...
just stop right there. There's something unbearably cute about tiny kittens hissing.
Yes, about an 8-week-old long-haired poof of hair that's just hissing every time you move.
Yeah, it's so cute.
It was, and that's how I fell for it. The Humane Society said we will not take them if they're not socialized, because obviously they won't get adopted. And so I said, all right. I had a couple dogs. I had another cat. I had this wire dog D crate.
A D crate?
I said, I can put these 3 kittens in this large crate, and they can just live in the middle of my house. They'll get socialized, and then they can be adopted. Well, of course, they had ringworm, and they gave ringworm to all of my pets, and then I had them all summer, and I'm out doing lime sulfur dips on my back deck, and I'm just, in the back of my head, no good deed ever goes unpunished. Here I have these kittens. And so... I bonded with these kittens, of course, and so when it was time to finally take them to the Humane Society, I said, someone will adopt 2 of them, and there's going to be 1 left alone, and I'll just keep it. He's a weirdo. He literally lives under my bed up in the box spring.
Okay, she is voting me for this cat that's in the cupboard.
For your fictitious cat in the closet.
My cat.
And now she has a cat that lives
under
your...
You made it sound like you lock your cat in the closet. I do not lock my cat under the bed. He comes out when the sun goes down.
Really?
He is 9 years old, and I cannot pick him up.
You've never seen him in daylight?
No, he'll come wandering out and he sees me and he stops like he's never met me before, and he runs back under the bed. He's bonded with my other pets. He's bonded with Hurley, my other cat. He loves my D. He weaves in between her legs and like headbutts her face, but he does not trust me. I can pet him when he's eating, but that's it. So he's kind of a weirdo.
Lime sulfur.
No, he will never trust me. But it has been almost 10 years.
Yeah,
I know.
It doesn't.
You know, it just shows you. It reminds me that they say that cats are loosely domesticated.
Yes,
That's a good word. So they can revert to wild in a generation. Like they're just
Absolutely.
a generation away.
Yes,
from wild.
had a technician that I worked with for years, and she was fond of saying cats would benefit from another 50,000 years of evolution because they're still wild.
Loosely domesticated. Yeah. Some looser than others. Yeah, it's very true. Yeah, it's very true. And I think it's really helpful to own pets of your own. So, for example, when I do lectures on diabetes, I always say to the audience, not that I wish a diabetic cat on you, but if you ever have a diabetic cat, you will know so much more about this disease, right? But just in general, those of us working in the profession, I think maybe you just understand those softer aspects of ownership a little bit better if you have pets of your own. Right?
Absolutely.
Yeah.
And it always helps when you're giving discharge instructions to a client to say, I've tried this with my own, both of my cats are male and I just moved them across the country and I was terrified that they were going to get idiopathic cystitis and they were going to block because they lived in the car for 3 days and I was just, like pouring gabapentin on top of them. Like, please don't stress. But I put out ice cube trays full of water and that's what they drink out of. And I put an extra bowl of dog water in the dog crate. My dog doesn't drink it, but my cats, because they think it's not for them, go in there and drink it. And so, just those little tips that you learn, you can pass those along. And I think it just makes you a better professional that you have those stories.
Okay, get a cat, drive your
3
cat
days.
over 3 days through America.
It was amazing.
What else?
And you survived.
Yes, that was stressful, but it worked. I gabapentin and trazodone.
Yeah.
Everyone slept except me.
That's right. Yes. So fortunately, you were not on gabapentin.
Yes.
Yeah. Well, I bet you have a few tips on transporting your cat by car.
I do. If anybody needs to get in touch about driving across the country with 2 cats, I put them in a canvas dog carrier. Yeah. And I just kept them in there. They had a litter box and I only fed them. It's terrible, but they survived. Half a can of food morning and night. And I would mix the gabapentin in that, but they were hungry. Yeah. They would eat it. Yeah. But of course it was November and I'm driving through Wyoming and it's -20. And so I'd have to take that whole crate out of the back of my car, walking into a hotel room. Oh, wow. It was pretty crazy, but we did it and it was great. Don't abandon your pets. Don't leave them behind. You can drug them and move them across the country.
Yeah. Better living through chemistry.
Exactly.
Yeah. So now that you have quite a bit of responsibility, it sounds like, for training future generations of veterinary technicians. I'm interested. So you are only the second veterinary technician we've had, right? I think you're number 2.
We have Kara Burns.
Kara Burns was number 1. She was terrified of us.
She was terrified. She said, what are you going to do?
She was terrified.
What are you going to do to me?
Yeah.
We're really nice.
Yeah, we're really nice. Kara, we're really nice. Yeah,
we are very nice.
So you're number 2. And I think we had the same discussion with Kara. So I'm interested in what you see as the future evolving role, because I think it's a rapidly evolving role, actually, of technicians. So I'd like to hear what you think about that. Where are we going? Where should we go?
I want to go to this profession being recognized as a profession. Yeah. That's the struggle right now is we're really at a crossroads with this can we mandate that technicians have to be credentialed to do this job? And we have been considered the girls in the back for so long, and it's been something, you like animals, you can be a veterinary technician. And we haven't been able to say this is a rigorous program of physiology and anatomy and pharmacology. And, so I think demanding respect and actually making this a true profession for people. And we can't say that without talking about money, and we can't say that without talking about licensing. And there's so much that goes into it, but that's where I want to see us go. There are some exciting thoughts in the future of creating this, kind of physician's assistant type role for technicians, but we can't talk about that until we talk about getting them licensed and having enough schools and having the respect of, rural veterinarians that want to hire credentialed technicians to do this job. And so that's a huge reason of why I do what I do, is that I want people to see how valuable technicians are to the medical team. And we have a very specific job, and we free up veterinarians to do more. There are very specific tasks that can be done by technicians that free up veterinarians to see more clients, to make more money, so that we can be paid more, so that we can get more respect, we can have more responsibility. It's just a big circle, and that's where I want to see us go.
We have such a wide range of what's in the workforce right now, all the way from not as skilled, uncredentialed people working in the veterinary maybe assistant role is a better word than technician role, all the way up to technicians who are now specialized. Technicians now can be as specialized or more specialized than the veterinarians they work for in many cases. So it's such a wide gamut right now. It'd be nice to see that tighten up.
Exactly.
And at least bring the bottom end up.
That's what I want to do. I am a veterinary technician specialist myself, and that has done a lot for my confidence and my career and my kind of how I see myself with the veterinary team. But I want to pull that bottom up. I love assistants. I have worked with amazing technician and veterinary assistants, and I think they definitely have their role. But right now it's so muddy between what a very skilled assistant is doing and what a not so skilled technician is doing, and we need to be able to define that a little better.
Yeah.
And how do you then think about nurse practitioners?
I look at anesthesia. I look at what those VTS anesthesia technicians can do with creating protocols, and I think that's an area that we could kind of work on. I also look at what technicians in emergency are doing with triage and urgent care versus true emergency, and looking at, this is an anal gland abscess. Here is, what I think we can do for this. Some of these very basic broken toenails and, routine ear infections, routine skin infections, routine GI upset that, oftentimes just need some sub-Q fluids and some time. And it's really muddy and it's really hard to kind of think about that. But I would love to see it evolve into that, where a patient could see a technician who could get the ball rolling on things, or could maybe even start ordering the diagnostics that could then be reviewed somewhere, so that we can just, keep some of these urgent care things over here with technicians, and then the true heart failure and massive traumas, and, those are going to go into the actual hospital.
Yeah, I think it's interesting that you say that, because I think the main limitation to nurse practitioners is really the veterinary healthcare team themselves. It's not the client, because the clients, when you go to a doctor, you don't see the doctor until you talk with the nurse practitioner. So they are used to that idea. It's just us not being able to delegate or let go, because there's some things that we want to keep doing. And when I do my lectures, I always talk about I let my students do the suturing, but I don't let my nurses to do the suturing. And I know that they're better than I am in it. And so why don't I?
Why?
And so one is the limitation. Sometimes it's the law, but most of the time it's our limitation of seeing the potential that people have and using that potential, and then also creating a job that people really like to do because they get that potential.
And I see it happening. Our internal medicine department, those technicians see tech appointments, and they're doing rechecks for, medication levels, or they're seeing I-131 cats come back, and just, I don't know what they're doing. I don't work in internal medicine, but they're drawing blood, and they're able to submit those tests, and then the veterinarian is going to review those and call the client. In general practice, for a lot of, the booster vaccines, you come in for your very first puppy exam and you're going to see the veterinarian, but then every 3 weeks you come back and see a technician. And there are some practices that are doing a great job with that. And those technicians have autonomy and they're, you know, doing a basic physical exam and saying, yeah, this puppy's eating and drinking and feeling good. We can go ahead and booster this vaccine, and they're educating the clients on what needs to happen next. And if we can take that and run with it and implement that in more practices, that's, I think, where we start with this. And we're not going anywhere close to outside the Practice Act. We're just utilizing these technicians for what they can do.
And when I was working in Colorado, we're getting a message. When I was working in Colorado at the oncology service there, I mean, the nurses, they almost did everything. I mean, they gave the chemo, they worked, you know, looked at the patient in the beginning. They ordered the blood work already, so the doctor could. And we had such a high caseload that was done, and they did such an awesome job. So I totally agree with you. Oh, and this is Susan now sending a message. Thank you, Susan. Yeah, that is wonderful. Yeah, I think, I think that is really the key, and just give them the trust.
Yeah. That's a huge part of it. Yeah. We're ready.
I know in other countries too, and by other countries I mean overseas, I also see or hear at least of technicians who will run clinics, so specific clinics, like for example obesity clinics, right? So the veterinarian might see the patient initially, work out the plan, make sure there isn't concurrent diseases, all of that, right? But then the rest of the clinic is run by vet nurses or vet technicians.
Absolutely.
Right? Because you don't necessarily need a veterinarian in every time to like weigh the pet and go over the owner issues and go over the nutrition plan. That's something that very specific, often that nurses or technicians actually do better than veterinarians. Yeah. Right. So I think we need to think more about things like that too, where we can run these very specialized types of clinics and have owners be happy because they'll probably get more time and more attention with nurse or technician appointments.
Right? Yeah. And that just encourages those technicians more. Like that feeds us, makes us feel like I'm contributing, I'm doing more than just following orders. And that's the key to longevity in this profession.
Yeah. I agree. Hopefully it's a rosy future.
Yes. Let's finish a little bit with the positive thing.
Yeah.
Okay. So we talked about the judging, and now you gave such a strong message about being positive.
Yes. I connect it to dog training. We all understand, and cat training. I've trained my cats to stay off the counters.
Well, that's something.
And it takes repetition, and you have to do it over and over and over again. And when I see them up there, I put them on the floor and they get food, and they only get rewarded if they're on the floor. And I try really hard not to leave food out on the counter so that they're rewarded up there. But it's repetition, it's positive reinforcement, but it's doing something over and over and over again until you understand that that is what you should be doing. And our brains work the same way when it comes to having thoughts, either positive or negative. And when we come to work and we complain and we judge, and this is so hard, and these people are so stupid, and I don't like this, and this dog is barking, and I hate it, you train your brain to go to the negative place. And you're just miserable. And it takes a lot of work to retrain your brain to be positive. But you can do that. The more you do something, your synapses grow closer and closer together. And if you work really hard at being positive, that's going to be your go-to.
So I can have a piece of chocolate every time I'm positive?
Every time you have a positive thought, you reward yourself. But you can retrain your brain.
I do like chocolate. It would work.
To be positive. And then you can have as much chocolate as you want when you're positive all the time. But I really, truly, there is science behind that. That's not just Megan telling you to put a smile on your face, but to just keep thinking, they're doing the best they can. I'm assuming good intent. I really enjoy what I do. I have this opportunity to do this. I am trusted to do this. I love the people I work with. That dog is so cute. That cat, it purred and it ate for me after not eating for 7 days. I finally made a connection, and remember those things and make those connections in your brain, and it's so much easier to be happy.
Accentuate the positive.
Exactly. It sounds so Disney, but it's true.
But it's true.
Yeah.
Thank you, Walt.
Yeah.
So
a good note to end on.
I love that. I think that's wonderful. And I think the last thing that you also said was you're allowed to vent. But don't do it at work.
Exactly. I think, you need to be able to talk about things that bother you, but have an adult beverage outside of work and keep those negative thoughts outside of work, because it's that building, it's that environment that you're going to get sucked into it. And if everybody in the workplace is trying to be positive, and if everybody agrees that we're just not going to complain while we're here, we're going to take that somewhere else, then it's a lot easier to remain positive. And when you're positive, then your pets are happier. How many people, I know I've worked with that technician that gets bit by a cat once every 3 months because their energy level is so negative and they're not thinking about what they're doing. And that's when that cat's going to figure that out. So just everybody is more positive, more relaxed, and it goes across everything.
It's the same coming in the door in the morning. You know, I noticed that myself. So you don't want to bring into the building with you what's been happening at home or whatever it is, right? Mm-hmm. So I know there's been times in my life I've had to make that conscious decision at the building door and go, okay, it's, you know, I'm crossing a line.
Yep.
That stays outside so I don't bring it into the building.
Exactly.
Because I think we do bring it. I mean, it's where we spend so much of our time, right, at work. So we bring it in with us.
Yeah.
Yeah.
And it's the way around too, because you give that example of welcome to.
Oh, yeah. When you come into work, especially in emergency, you're coming into a night shift or swing shift. And so you can walk in the door sometimes and just feel the anxiety. And I'm like, okay, it's going to be all right. I'm going to work hard. We're going to get through it. And you walk in and a coworker turns to you and goes, welcome to hell. And then it just ruins everything. And then I'm like, I don't want to be here. And I'm starting this 10 or 12 hour shift in a bad place. So
I think we should just give out chocolate as you come in the door.
See why that's a problem.
Right?
Exactly.
It's the answer. Chocolate.
So this has been wonderful, Megan. Thank you so much for
so much to talk about.
I know we can keep on talking and talking and talking. So we need to get you back. We say that to most of our guests.
We do.
Guess, you know, because it's just we're kind of talkative ourselves. So we love to talk about
we
things.
do.
But, you know, we try to keep it at 20 minutes each time, 25 minutes.
Okay.
So, but we really appreciate you being here.
Thank you so much.
Thank you for your insights, and I hope people enjoyed this podcast.
Yeah, and good luck with that next VMX award.
I know.
I'll work on that.
We're voting for you. So thank you so much.
Thank you.
Bye.
Bye.
The opinions of this podcast are those by Dr. Susan Little and Dr. Jolle Kirpenstein. Veterinary medicine is a complex profession, and often there are multiple diagnostic and therapeutic options for different disease processes. If you're a pet owner with questions, please go to your local veterinarian. If you're a veterinary professional, ask your questions on our Instagram page @Purr Podcast. Dr. Susan Little is a feline medicine specialist with 2 cat-only hospitals in Ottawa, Canada. She is best known as an international speaker and as the author and editor of 2 textbooks, The Cat, Clinical Medicine and Management, and August, Consultations in Feline Internal Medicine. Along with 3 cats, she also admits to owning 2 dogs, and you can follow her on social media with the handle @CatVetSusan. Dr. Jolle Kirpenstein is a diplomate of the American and European College of Veterinary Surgeons and a big cat fan. His specialties range from surgical oncology and reconstruction to minimally invasive surgery. He is the author of 2 textbooks on basic and reconstructive surgery. Did you know he was allergic to cats? Jolle works currently at Hill's Pet Nutrition. You can follow him on social media with the handle @GVETSX.